Good day, sir. I'm Stephanie Mermanasaderas, midwifery 2. I'm here to discuss to you the family planning method. I choose lactation amenorrhea method and male and female condoms. The lactation amenorrhea method was created to allow women to safely rely on breastfeeding as a family planning method. Based on scientific research, the method uses three measures of a woman's fertility. First is to return of her menstrual period. Second is her patterns of breastfeeding. And the third is the time postpartum. The method requires breastfeeding of the baby every 4 hours during the day and every 6 hours at night. No supplementation of other foods or formula. No return to menses. And the baby must be less than 6 months old for perfect use. Lactation amenorrhea method may help to improve breastfeeding and weaning patterns. Breastfeeding patterns required for lactation amenorrhea method are associated with decreased reproductive tract cancers, anemia, and osteoporosis for the mother. These breastfeeding patterns also improve the growth, development, and survival patterns among infants. The disadvantage with use of the lactational amenorrhea method are full or nearly full breastfeeding may be difficult for some women to maintain due to social circumstances. There is no protection against sexually transmitted diseases, including HIV infection. The duration of the method is limited to a brief postpartum period. Lactation amenorrhea method is a temporary method that can only be used by breastfeeding women. In addition, it may be difficult to convince some providers unfamiliar with the method that lactation amenorrhea method is reliable to contraceptive. Education about lactation amenorrhea method can help these providers understand its effectiveness and appropriate uses. A family planning method based on breastfeeding provides contraception for the mother and breastfeeding for the baby. Can be effective for up to 6 months after childbirth as long as monthly bleeding has not returned and the woman is fully or nearly fully breastfeeding. When is lactation amenorrhea method no longer effective? A woman who chooses to rely on lactation amenorrhea method should be advised that the method is short term, up to 6 months, and is no longer effective when any one of the three criteria changes. The second is male and female condoms. The male and female condoms should not be used at the same time because friction can break them, make them stick together, or make one or the other slip out of place during intercourse. If a condom breaks or slips, semen can get through, making the condom less likely to prevent pregnancy or STDs. The difference between a female and condom of a male condom is that with a female condom, the woman inserts this into the vagina rather than the man wearing the condom. As in the case with a male condom, in addition, female condoms are also often more expensive to buy than male condoms and may be harder to find. This is considerably higher than the 14% change of pregnancy while using a male condom. You can only use one of the condoms at a time. Male and female condoms cannot be used together. However, other contraceptives such as spermicides or the oral contraceptive pill can be used with either the male or the female condoms. Find a comfortable position. While holding outside of condom at close end, Squeeze sides of inner ring together with your thumb and forefinger and insert into the vagina. It is similar to inserting a tampon. Using your finger, push inner ring as far up as it will go until it rests against cervix. Condoms are effective against STDs. Condoms and internal condoms are the only method of birth control that also help prevent the spread of sexually transmitted infection like HIV, chlamydia, and gonorrhea. Disadvantages of using a condom. Reduced sensitivity during intercourse is a commonly voiced concern with couples who opt for condoms as a contraception method. Some couples claim that the pressure during sexual intercourse is reduced due to the barrier posed by the latex condoms. Barrier method of birth control prevent pregnancy by blocking sperm. This stops the sperm from reaching an egg. Types of barrier methods include condoms, diaphragms, cervical cups, and the contraceptive sponge. Barrier methods work better when you use them with a spermicide. Theoretical, you should be protected from pregnancy about 1 week after starting with control. With that said, using condoms is always a best practice in order to prevent the spread of STIs and other types of infections.
Okay kayo. Maging dugay ng istorya para makatra